Hi, I'm Luca Bertamini from the myeloma unit of the University of Turin, Italy, and I will talk to you about circulating plasma cells as a high-risk feature in multiple myeloma. Well, circulating plasma cells, that mean plasma cells in the peripheral blood, tumor plasma cells in peripheral blood, have been known as a risk factor from more than 20 years in myeloma, and not only myeloma. It is known to be associated with a prognostic impact also in MGUS, smoldering myeloma, and myeloma diagnosis and relapse. Well, this prognostic feature has been studied with different methods, with different techniques in the last 20 years. For example, immunohistochemistry, flow cytometry, or even next generation flow. What we know is that all these studies correlate CPC, so circulating plasma cells, with an adverse outcome in terms of survival, progression-free survival, and overall survival. We also know that circulating plasma cells is a prognostic factor, but is it independent from other prognostic factors, or is it somehow linked to other well-known factors such as cytogenetic abnormalities and so on? Another important question in circulating plasma cells is that does it reflect some different biology of myeloma, or is it correlated with a more important disease burden, so greater percentage of plasma cells in the bone marrow, for example, or higher lactate dehydrogenase? We addressed some of these questions in our study. We recently had the opportunity to present at ASH meeting this year. We were also interested in look at prognostic impact of circulating plasma cells, not only as a continuous variable, but to find a cutoff value to discriminate a population with very adverse outcome, with high circulating plasma cells. Well, we analyzed data of a clinical trial, and we were able to identify a cutoff that is prognostic for progression-free survival and overall survival, and as well as correlate circulating plasma cells with other risk features. As I said, so abnormal cytogenetic abnormalities, lactate dehydrogenase, other well-known risk features, so ISS and revised ISS. What we then showed is that this prognostic impact is independent on these other risk features, and is interestingly can be modulated by good response to therapy in terms of minimal residual disease negativity. So to sum up, circulating plasma cells is an interesting feature, high-risk feature, is well known since 20 years, but there is no standardized data and method to allow physicians nowadays to include it in a baseline evaluation for risk assessment. We suggest that analyzing circulating plasma cells with flow cytometry could add some information in the risk evaluation, together with the well-known baseline features, so the ISS, revised ISS, cytogenetic abnormalities. And moreover, this high-risk feature could be modulated by the achievement of a good response in terms of minimal residual disease negativity.